Empowered nurses are really important. It goes hand in hand with patient advocacy.
I think an empowered nurse for me is someone that keeps my patient first and foremost. They're the centre of my work and advocating fiercely for them to ensure best outcomes.
I think that nursing is a very privileged position in that the relationships that we build with our patients position us really well to advocate for what's best for them.
Empowering our nurses to escalate their concerns can be the key difference between early intervention and serious deterioration.
I think at the bedside, being empowered helps nurses to create the best outcomes for their patients.
As nurses, we are the ones by the bedside. We are the ones spending the most amount of time with the patients and noticing those subtle differences that can indicate that something's not quite right.
It's around psychological safety, where people actually feel safe to speak up and to ask questions and continuously question why we're doing what we're doing for our patients, and feel safe that they will be heard and listened to.
It's underground in the culture that we build in the emergency department that everyone has a voice. There's no sort of pressure in the fact that if you have a very junior nurse that's just come in, that's just left university, but they see something that they're concerned about, the consultant will stop and listen.
We're all different, we've all come from different backgrounds, we've all got different experiences, and we all have a different way of looking at something. So we might see something from one point of view that the other person hasn't seen. So if we can keep a respectful environment and keeping it psychologically safe so people actually feel safe to speak up.
Creating a culture where nurses feel safe, secure and valued. It's giving them a space where they can ask questions and escalate those concerns without feeling like they're going to be criticised or dismissed.
Can be really difficult especially for early career nurses to speak up to someone that they respect, someone that's been around for a lot longer, someone that they see who has more knowledge than they do.
If you're a junior nurse, you may feel really uncomfortable speaking up in those sorts of situations, especially if you're dealing with a more senior person that you need to speak up to. Also, just having confidence in your own skills and knowledge. Sometimes we feel unsure, and that can really lead us to hesitate when it comes to speaking up.
Realising that I'm actually respected and my opinion matters, and just remembering that the patient that I'm looking after needs my voice because they don't have that ability to speak up for themselves.